we have collaborated with philanthropic fund like ACT, which was a really exciting effort of around 100 crore, which would be possibly around, if I may to say, 25 million, or I don't know, or less than that, 15 to 18 million. They have actually done very well, and we have collaborated to even support academic efforts which would aim to build that. So we have been able to even build that, while DBT, while others are also support DST and all are doing the funding for the academic researchers as well. Already a funding program, couple of bilateral funding programs which have begun, and that would be something that I think innovators from other countries should do that. So there is an Indo-US COVID-19 call that is open. I'm just saying there's a call open from Sweden, and there'll be a couple of more European bilateral call would be open very soon, where collaborators from both parties can come together and get funded for that. So that is also definitely available. I think it's very important, right? Because I think in this such times, I think you need to understand the scientific leadership is key, and current PSA, Principal Scientific Advisor to the PM, himself being a top-notch development biologist, that allows a sync with the rest of the system in terms of how it goes forward. And I think there should be a way how scientifically trained people should slowly move towards position where they can leverage their science and influence a larger and ensure that comes through a larger system. I think that's a very, very important thing. We are seeing it at multiple places. Dr. Soumya Swaminathan is one example, and I would say even the Chancellor of Germany is an example of scientific turned leadership that actually happens. That is clearly says that how measured the responses would come for such situation if you have scientists also taking leadership in terms of larger policy making bodies. I would say that considering this could be definitely a dialogue between India and Europe or Germany per se, I think the challenge is global. I think we all know the challenge is global, and the nuances of challenging may differ, but the broad subcategories of challenge are the same. I haven't seen a real across larger international effort to actually possibly have a collaboration to build that. Not an individual research level, but a larger level. This may not have happened because all of us got suddenly stuck by this humongous challenge, and we had to fend for ourselves to figure out what do we respond. But it will be lovely to see that how now, when at some geographies, and now we are possibly learning to live with it, how can we now understand to collaborate in such a disaster management level system in terms of biological threats like this? How do we have system as proactively to have the countries can use the ones who are affected by that? There has to be some level of preparedness, a global preparedness for biological threats like this in future, so that the countries who may not have all the wherewithal but are affected can learn from there, can be supported, and so on. That would be a good learning for all of us, I would say.